I was originally trained as a clinician. I worked at a critical access hospital in southern Vermont for a number of years. I found myself sort of getting interested in health policy, so I pursued training in health services research at Dartmouth, and I've been doing health services research ever since. A lot of my work, I work in a variety of different areas, but focuses on Americans who consume a lot of healthcare resources. For instance, we're studying people with chronic, persistent back pain, identifying strategies that are efficient at treating those individuals. We're also conducting a number of studies looking at spending in the last year of people's life when people use a lot of healthcare resources, with the effort being to try to disentangle some of these patterns and hopefully providing policymakers with the tools they need to make more informed decisions. Whenever I think about designing a study, I try to think about what healthcare policymakers need, the information that they need to make good decisions about healthcare system redesign. When we have the same theoretical patient that can see different provider types, which provider type is the right provider type to manage that patient in the way that leads to optimum health outcomes at a reasonable cost. I would say that the work that we do is aimed at informing the big decisions about what services to include and how to include them and how people can work together in improving the lives in which the healthcare system serves. There are a lot of issues facing American healthcare, but besides from issues pertaining to access and equity, I would say sort of the thing in my mind that sort of encapsulates the fundamental issue with the U.S. healthcare system is both the wide variation and the lack of relationship between healthcare spending and health outcomes. I had heard about IHPI through publications and networking and seeing the work that has come out of this institution prior to visiting campus. And when I was brought in, even during the interview process, I came here and met with people here and got connected, started to realize just how vast the resources are that are connected to the Institute. To be completely honest, IHPI is one of the reasons I came to the University of Michigan. And becoming a member was one of the first things I did when I arrived. There are a lot of people here doing work related to health and healthcare policy. In my mind, IHPI really is a place for those people to come together, both a physical place, but also sort of an intellectual resource for these people to tackle some of these problems through multiple lenses and perspectives. I've benefited dramatically from IHPI already, just in terms of identifying other researchers with similar interests and goals. But as an early stage investigator, in other words, someone that's early in their research career, there's been some incredible resources that I've used pertaining to grantsmanship, manuscript preparation, and access to senior mentorship in the specific area that I want to pursue. In my mind, some of the issues that we're faced with have to do with the lack of incentives kind of making sense in terms of how healthcare is delivered. I believe that in the coming years, and I suppose my hope is that we'll see a shift in incentives towards outcomes that should make sense, outcomes that are about improving the health of the people and the communities in which the system serves. IHPI is making some of this possible. I think a lot of the work done here is informing these big decisions, evaluating systems and incentives with the aim of making things a little better.